Cholesterol. It's something we've all heard of, but how much do you really understand about it? You've probably been told that cholesterol is bad for you and that it increases the risk of heart disease and stroke. But what if I told you that cholesterol is not the villain it's made out to be? What if I told you that, in fact, it's essential for your body to function properly? The truth is, not all cholesterol is bad. Your body actually needs cholesterol to maintain cell health, produce hormones, and even help you digest food. However, there's a catch. Not all cholesterol is created equal. When we talk about cholesterol, we're referring to two types: LDL, low-density lipoprotein, which is often called the bad cholesterol, and HDL, high-density lipoprotein, which is considered good cholesterol. While LDL cholesterol can lead to plaque buildup in your arteries, cause blockages that can lead to heart attacks and strokes, HDL cholesterol actually works to remove excess cholesterol from your bloodstream, helping to prevent this damage. But here's where it gets interesting. The real problem is not just the amount of LDL, but the type of LDL particles in your blood. Before we jump into the details, ask yourself, what if everything you thought you knew about cholesterol was incomplete? The truth is, most people don't fully understand it, and this could be the missing piece to protecting your heart. If this sounds like something worth knowing, consider sharing this insight with someone who could benefit. And if you're ready for more, don't forget to subscribe. You're not just gaining information, you're gaining control. Now, let's uncover what you really need to know. What is LDL cholesterol? When we talk about LDL cholesterol, there are two types of particles: large, buoyant LDL particles. These are not a major threat. Small, dense LDL particles. These are the real problem. Why? Because they can penetrate the artery walls, causing inflammation and contributing to the development of plaque. The small, dense LDL particles are the most dangerous for your heart health. But here's the key. You can lower the levels of small, dense LDL particles in your blood. And one of the most effective ways to do this is through diet. Let's talk about how you can take control. Foods that help lower bad cholesterol, LDL. Your food choices can directly affect your cholesterol levels. The right foods could lower LDL cholesterol and promote healthy arteries, while the wrong ones can increase your risk of heart disease. Here are the top foods you should be including in your diet to lower LDL cholesterol and boost your heart health. 1. Unsaturated fats, the heart's best friend. When it comes to fats, unsaturated fats are your allies. Olive oil, avocado, and rapeseed oil are rich in these healthy fats, which help lower your LDL cholesterol levels. So, instead of using butter or lard, switch to healthy oils and consider adding avocados to your salads or using olive oil for cooking. These healthy fats can help balance cholesterol levels and reduce your risk of cardiovascular disease. Oats and barley, fiber to the rescue. Oats and barley are high in beta-glucans, a soluble fiber that can help to block the absorption of cholesterol into your bloodstream. A simple breakfast of oatmeal or adding barley to your soups can reduce your cholesterol. You don't have to make drastic changes. Adding just 3 grams of soluble fiber a day from oats and barley can help keep your cholesterol levels in check. Beans and lentils, plant power for your heart. Beans and lentils and peas are excellent sources of soluble fiber, which helps lower bad cholesterol levels. Additionally, swapping out red and processed meats for these plant-based proteins can reduce your intake of saturated fats, making it easier to manage your cholesterol levels. Consider making lentil soups or bean-based stews for heart-healthy meals. Nuts and seeds. Snack smart. Instead of reaching for a sugary snack, try nuts like walnuts, almonds, or pistachios. These are packed with unsaturated fats and fiber, both of which contribute to lower LDL cholesterol levels. Nuts are not only filling, but can also help control your weight, which is essential for managing cholesterol levels. But remember, a small handful, about 30 grams, is the ideal portion. Fruits and vegetables. Fill your plate with fiber. We all know we should be eating more fruits and vegetables, but did you know they're also a powerful tool for lowering LDL cholesterol? High-fiber foods like apples, berries, and green leafy vegetables have been shown to reduce cholesterol levels significantly. Aim for at least 5 servings of fruits and vegetables a day. They are rich in antioxidants and soluble fiber, which can not only lower cholesterol, but also reduce inflammation and support overall cardiovascular health. Fatty fish. Omega-3 fatty acids for heart health. Fatty fish, like salmon, mackerel, and sardines, are rich in omega-3 fatty acids. These healthy fats lower triglycerides, raise HDL cholesterol, and reduce inflammation. Regular consumption of these fish can improve heart health and reduce the buildup of plaques in your arteries. Aim for 2 to 3 servings of fatty fish each week to lower LDL and support overall cardiovascular health. Dark chocolate, a sweet way to lower cholesterol. Yeah, you heard that right, dark chocolate. Cocoa contains flavonoids, which have been shown to lower LDL cholesterol and increase HDL cholesterol. Opt for chocolate with at least 70% cocoa and enjoy it in moderation. This treat can help reduce oxidative stress and inflammation, both of which are linked to heart disease. How to avoid foods that increase cholesterol. While the right foods can help lower cholesterol, others will do the opposite. Here are some foods you should avoid to keep your cholesterol in check. Saturated fats, found in butter, full-fat dairy, fatty meats, and processed foods. Limit these to less than 10% of your daily calories. Trans fats, found in margarine, deep-fried foods, and commercial baked goods. Avoid these as much as possible. Refined carbs and sugary foods. These can contribute to high triglycerides, which are linked to heart disease and poor cholesterol levels. Understanding cholesterol tests. You may have heard of cholesterol levels like LDL, HDL, and triglycerides, but do you really understand what they mean? A lipid panel blood test is used to measure these levels. Here's what you need to know. LDL cholesterol. Bad cholesterol, ideally less than 100 milligrams per deciliter. Higher levels contribute to plaque buildup in arteries. HDL cholesterol, good cholesterol, ideally greater than 60 milligrams per deciliter. This type of cholesterol helps remove bad cholesterol from your arteries. Triglycerides, ideally below 150 milligrams per deciliter. High triglyceride levels often accompany high cholesterol levels and increase your risk of heart disease. It's important to discuss these numbers with your healthcare provider and understand what they mean for your individual health. How to manage cholesterol in seniors. Cholesterol management becomes especially important as we age. Research shows that high cholesterol is linked to heart disease and other vascular problems. But there's more to the story. Even seniors with high cholesterol who make lifestyle changes like eating a balanced diet, exercising regularly, and managing stress can significantly reduce their risk of heart disease. However, for some, medications like statins may be necessary. But remember, statins work by lowering LDL cholesterol, not necessarily reducing the small, dense LDL particles that are the most dangerous. Therefore, dietary changes are just as important as medications in managing cholesterol. You now know the importance of managing cholesterol and how it impacts your heart health. By making simple, smart food choices and adopting a healthier lifestyle, you can lower your LDL cholesterol, raise your HDL, and dramatically reduce your risk of heart disease, stroke, and other complications. So, don't ignore your cholesterol. Stay informed, stay proactive, and take the steps necessary to protect your heart and overall health. The power is in your hands. Keep track of your cholesterol, eat the right foods, and live a long, healthy life.